therapy. I'm also the owner of Time for a Change Council, which is a private mental health practice in Brookhaven, Mississippi. And so today I am honored to talk about mental health, some of the stigmas associated with mental health, but also how do we help and support those around us who may suffer with mental health. So the first thing I want to tell y'all is honestly everybody has mental health, right? Mental health is just like physical health. The only difference is a lot of times when it comes to our physical health, if you knew somebody who, or let's say you had a pain in your leg, right? Or you had a pain that wouldn't go away, you would probably be one of the first people that would go to the doctor, right? Who all would sit there and let a pain just continue? And so the same thing when it comes to your mental health. And the thing about having something going on with your mental health is it could be, sometimes you're just not feeling good, or sometimes you're feeling anxiety, or sometimes you're feeling sad and depression. Now the thing about sadness and depression and anxiety is that some of those are normal. Some days you might wake up and just not feel like it, right? You may feel a little sadness. You may feel anxious about something. If you got a big test coming up at school, it's okay to feel anxious about that. Or if you have a big review coming up on the job, it's okay to feel anxious. But when you are feeling sadness or anxiety and it's causing you day after day, and it's just no matter what you do, you're not able to shake it. Like you're not able to function in terms of you find yourself crying all the time. Somebody asks you how you doing and you welling up and you're crying, right? Or if things are going on in your life and let's say it's graduation season, you have somebody in your life that's graduating and you go to the graduation and the whole time you're there, you just would rather be in the bed and you're tired all the time and you're having a hard time sleeping and you're finding yourself even having a hard time eating. Either eat too much or not eating at all. Then those are times where I would definitely recommend that you go to a professional and get some help with your mental health. Because that may be something that's going on beyond just the regular anxiety and depression. Now the thing about it is, in our community, especially the Black community, there is a stigma associated with mental health, right? So a lot of times people feel like if you go get help for mental health, then that means that there's something wrong with you, right? So part of it is, in order for people to be able to be more comfortable and decrease the stigma, we as a community, we have to be the change that we want to see, right? One of the things I encourage, for one, I don't use the word crazy, right? Because who wants to be labeled as crazy? And one of the things I always tell people, if I call you crazy, I'm going to have to call myself crazy too, right? And so one of the things that I do in my personal life is I don't use the word crazy. Also, so thinking about the words that we say to people, because if we're telling people, hey, it's okay to go get help for mental health, and somebody comes to you and say, hey, I just don't feel good, and your response is, girl, just pray about it, right? Or your response is, girl, you better shake it off. Or your response is, well, if you would have done this I told you to do, then this would have been the outcome. So if those are the conversations that you're having with people, then we are continuing the stigma when it comes to mental health. We can't control if somebody goes to get help. All we can do is control how we respond to them when they come to us. I tell people all the time, people come and they pay me to talk to me about their problems, a total stranger. And people ask me all the time, why would I come and talk to a stranger about what I have going on? And I say, because I don't judge them. One, I don't judge them. And two, I don't tell them that they're wrong. If somebody comes to me and say, you know what? Man, my mama really did die. I don't tell them, well, girl, your mama loves you, and your mama doing that because she care about you. I'll listen to them, and I'll allow them to have their feelings and have their say about the thing that is going on. And so one of the things I encourage everybody to do is to think about the words that you are saying to people. And not just in the moment, but the words that you say to people. Because if somebody overhears you saying, oh, that girl really don't want it. She really don't want to end her life. She just wants some attention. Then if I'm having the thoughts of ending my life, you're not a safe person to talk to. Right. And the reason you're not a safe person to talk to is because I've heard you talk bad about other people who have the same situation I'm dealing with. Okay. So it's about the words, but then also about the action. What are the things that we do when we are interacting with people who may be dealing with mental illness? do we stop and do we listen, or do we kind of minimize it and tell them to go do something else? So thinking about your actions and what you choose to do when people come to you to talk about it. Part of it is us knowing we can be the person to save somebody's life. Because before people get to me, and I'm just being 100% honest, before people get to me, they have tried to talk to so many other people in their life. And there are not a lot of people in their life who encourage them to go talk to a therapist. They tell them to pray about it. They tell them to talk to the pastor first. They tell them to sleep on it. They tell them to, oh, if you just did this, you know, if that job is stressing you out, just leave the job. But honestly, the thing about it is sometimes it's about how do we deal with the stress. So my encouraging words for everybody is if somebody comes and talks to you about having a difficulty with their mental illness, listen to what they're saying without judging it. No, it might not impact you the same way it's impacting them, but what they're telling you is this is impacting me. So don't minimize what they're telling you. Don't minimize what they're asking you for. Because simply listening to somebody when they're telling you, hey, I'm struggling with this, this, and this, could truly and honestly save their life. But also it can lead them in a path where they will have the understanding that, you know what, somebody is willing to listen to me. Somebody can listen to me, and there is help out there. Now, every time you're dealing with something, you may not have to come to a therapist. But I encourage everybody to come to therapy. And not just because I'm a therapist, right? But I really think that there is a benefit to being able to have somebody objectively to talk to just about the things that are going on so that you don't feel like you're out there floating around in the world. There's so many people I talk to who we're all having common symptoms and we're all having common issues, but we don't talk about it. And so it's hard for me to come to you as a friend, as a co-worker to talk about how I'm feeling when I think you have it all put together. But the reality is there's so many times where I've sat into rooms with a group of people, and once one person say, oh, I deal with that, the other person say, I deal with that, and then they feel seen and heard. But a lot of times, if you are dealing with a mental illness, if you're dealing with anxiety, dealing with depression, we don't talk about it enough, so people feel like they're out there suffering by themselves. And so that's part of reducing the stigma, to say, you know what, sometimes when I get up in the morning, I don't feel like it, right? Sometimes I get up in the morning and I wish I could lay back down, right? I wish I could just call in and not have to go to work. Or sometimes when I'm doing something, I feel real anxious about it, or there's a lot of anxiety. And that helps people to be able to open up to say, you know what, I feel the same way too, and that's okay, right? So thinking about the words that we say to people, the conversations that we are having, so that people can feel comfortable talking to us. But then how do we respond to people? Because if somebody comes to you and says, I'm having a hard time, you know, when you tell them, hey, pray about it, give them a specific scripture, and then give them something else that they could do, right? Because we know that faith without works is what? Dead. So we have to be able to do something else. You don't have any questions, comments, or concerns?
Do you charge for your counseling?
Well, I accept insurance.
You accept
Yes,
insurance?
ma'am, I do accept insurance.
Okay,
And I'm in Brookhaven.
Can you give me your information one more time?
So I'm in
Your name?
Brookhaven, Megan Ham, licensed Christian counselor, rest place therapist. And my office is in Brookhaven, Mississippi. And you can call me at 601-207-9531. It's Time for a Change Counseling in Brookhaven, Mississippi.
Do you have anything on the brochure with that number?
I don't, but I can scan it. I can write it down. Okay.
Hey, I'm so glad you're all here. Thank you for coming to play. All right, we appreciate it. You do take insurance.
I take insurance.
Okay, have a great night. Okay.